Hello, good day everyone. I am Guadalquiver and I am your student nurse from DAVAO Doctors College. And so for today, I will perform a written demonstration of obtaining vital signs. Taking vital signs in every patient visit can be vital to the health of the patient. Vital signs include body temperature, blood pressure, heart rate, and respiratory rate. Additional vital statistics used to identify predisposition of disease or disorder and that assists a proper dosing of medication includes height and weight. Before doing the assessment, we should verify what we need to perform the vital signs taking. So first is to check for the document or the medical record of the client. Of course, don't forget to check for the needed equipment. And that includes the thermometer. The thermometer is to measure the temperature gradient of the hotness or coldness of the patient. The stethoscope is to listen to the internal sound of the human body. The BP apparatus is to measure the blood pressure. Cotton swabs is to clean the earpiece and diaphragm and belt of the stethoscope. Sterile gloves is to protect ourselves from the client. And lastly, alcohol to sanitize our hands. So now we are going to proceed to the working place. First of all, provide client's privacy. Introduce yourself and of course, verify the client using the two identifiers and don't forget to perform hand washing. Hello, good morning, ma'am. I am Guadalquiver and I am your student nurse for today. So, what is your name, ma'am?
Edna Huerte,
When is your birthday?
October 25, 1957.
And what name should I call you?
Edna.
So, the procedure that I will be doing to you is to take your vital signs. So, I am going to touch some parts of your body and of course, there are some procedures or movements that you should follow. Is that okay with you, ma'am?
Okay.
Okay, ma'am, thank you. So, please, place the client appropriately and get the thermometer using the alcohol swab. In a firm swab motion from dip, stem to probe. So place the thermometer now and I'm going to perform the oral method. So place the tip of the thermometer in the side of the frenulum. So ma'am, can you open your mouth and can it close and kindly hold the thermometer? And do not forget to turn on the thermometer and wait for the appropriate amount of time after its placement so the electronic thermometer indicate completely reading true light or tone. So, can you open your mouth? So, your temperature is 35.2 degrees Celsius. So, remove the thermometer and wipe the tip of the thermometer using alcohol swab in a firm twisting motion prior to displacement from stem to probe. To lessen the spread of contamination. So, wipe from least contaminated to the most contaminated area. And wash the thermometer if necessary and return it to the storage location. Of course, document the temperature of the client. Okay. For the auxiliary temperature method, ensure the client's privacy and of course, have the patient to the supine or sitting position. So, Edna, I'm going to move the sleeve of your shirt up away from your shoulder and arm. Is that okay with you?
Okay.
Okay, so can you raise your arm for me? Okay, thank you, ma'am. And inspect the axillary area for any lesions or perspirations. Pat the axillary area. To put this, I'm going to put this, okay. Okay, thank you, ma'am. So I am going to put this thermometer in your arm, and can you, I'm going to put this on your arm, and can you close your arm and do not forget to turn on the thermometer. So wait for the appropriate time and amount of the thermometer amount of time after its placement. So remove the thermometer and wipe it through a twisting motion from stem to probe. And your temperature is 35.6 degrees Celsius. And do not forget to document the temperature of the patient. Okay, thank you, ma'am. Okay, thanks. Hello, ma'am. Good morning. I am Guadalquiver and I am a student nurse for today. So, ma'am, what is your name?
Edna Huerte.
When is your birthday?
October 25, 1957.
And what name should you want me to call you?
Edna.
Okay, ma'am, thank you. So the procedure that I will be doing is to take your vital signs. So I'm going to touch some parts of your body, and of course, there are other procedures or movement that you should follow. Is that okay with you, ma'am?
Okay.
Okay, ma'am, thank you. So to take the radial first, assess to the factors that can affect the rate and rhythm, such as the medical history, disease, process, age, exercise, and medication. Help the patient to the supine sitting position. And now, if supine, place the forearm along either side with the wrist. Extended, then place the tip of your 2 by 3 middle fingers over the glute along with the thumb side of the patient's wrist. Okay, ma'am. Then slightly extend or flex the wrist of the patient. Then calm down until you feel the strongest pulse. So count for 30 seconds and multiply the rate by 2 if the pulse is regular, and if the pulse is irregular, count a full minute. Then don't forget to record the pulse beats per minute in the worksheet. Okay, ma'am, thank you. Hello, ma'am. Good morning. I am Guadalquiver and I am student nurse for today. So, ma'am, what is your name?
Edna Huerte.
When is your birthday?
October 25, 1957.
And what name should I call you?
Edna.
Okay, ma'am. Thank you. So, the procedures that I'll be doing is to check your vital signs. I'm going to touch some parts of your body, and of course, there are movements or procedures that you need to follow. Is that okay with you, ma'am?
Okay.
Any concerns or questions?
None.
Okay, ma'am, thank you. So, the body respiration, observe a complete respiratory cycle or palpate and count respiratory rate. So, okay, Edna, do you have past illness regarding respiration or are you asthmatic?
No.
Okay, so does anyone in your family smoke?
Yes.
Do you exercise regularly?
Yes.
Okay, so now I'm going to start the assessment. Is that okay with you?
Okay.
Any concerns or questions?
None.
Okay, thank you. So, have the patient in a comfortable position, preferably sitting or lying in the head of the bed, elevated 45 to 60 degrees. So, make sure that the patient's chest is visible. Then place your arms in the lower chest or upper abdomen so as you assess the pulse. Okay, ma'am, thank you. So, observe a proper respiratory cycle, one for the inspiration and one for the expiration. Count 30 seconds and multiply the number of breath by 2. So, a respiratory range normally ranges to 12 to 20 beats per minute. And if it's irregular or less, then 12 or more than 20 beats per minute. Count in a full 60 seconds. So while assessing, observe the chest of the patient or observe chest wall. Okay, so ask the patient to compare any shortness of breath. So, okay, ma'am. So, Edna, do you have any breathing problems?
None.
So, well, your respiratory rate is 17, which is your normal range. So, any questions or clarifications?
None.
Okay, thank you. And don't forget to document. Okay, thank you. To take blood pressure by one-step method, first is to check the patient's baseline and reading, and document, of course, determine the best site to use. Introduce yourself and identify the patient using the two identifiers. So, hello ma'am, my name is Guadalquiver and I am your student nurse for today. So ma'am, may I know your name?
Edna Huerte.
When is your birthday?
October 25, 1957.
Okay ma'am, is it okay with you to take blood pressure?
Yes.
Okay. Any concerns or questions ma'am?
None.
Okay, thank you. So now position the client appropriately. The client should be sitting unless it's otherwise specified, and the feet should be on the floor. So slightly flex the arm. So the palms facing upward or the palm facing up with the supportive or arm supported at heart level and expose the upper arm. So now, make sure that the equipment is intact and functioning. Check for the cuff size and tubing between the cuff and the bulb and the sphygmomanometer. Make sure that the patient has not smoked and ingested caffeine within 30 minutes prior to its measurement. So, ma'am, did you smoke or ingested caffeine?
None. No.
Okay, thank you, ma'am. So, rub the deflated cuff evenly around the upper arm. And locate the brachial artery. Now, clean the earpiece, diaphragm, and the bell. Then put the earpiece in your ear, ensure it hangs freely. Put the stethoscope on the skin and not in the clothes. Hold it with your 2 fingers. Now let's auscultate the client's blood pressure. Pump the cuff until this sphygmomanometer reaches 30 mmHg, about the point where the brachial pulse disappeared. Now release the cuff until the pressure decreases. So as the pressure falls, identify the manometer reading. First is the carrot cough sound or the systolic sound, which is the blood sound you've heard. Then the carrot cough sound phase is phase 4, or the diastolic sound, which is the sound become muffled and soft, and the carrot cough phase 5, followed by the period of silence. Deflate the cup rapidly and completely, and repeat the steps to confirm the accuracy of breathing. So and then just relax because I'm going to repeat the procedure again. So now remove the cuff and disinfect. So the last thing is to summarize the findings obtained during the working phase. Provide the client the opportunity to ask or raise the concerns, and don't forget to thank the client for the time and cooperation and perform hand washing. And don't forget to document the result of the blood pressure. So Edna, in taking the vital signs, the results show it's normal, and you don't have to be worried. So I will monitor you from time to time. So are there any questions or clarifications? Okay, thank you. So thank you for your time and cooperation.
Okay.
And that's the proper way of taking vital signs.